My name is Max, and for my animal physiology project, I chose to cover extra-hepatic portosystemic shunts in canines. By the end of the presentation, I will cover both its societal relevance and the impacts it has on canine physiology. So, what is PSS? Portosystemic shunts are abnormal blood vessels that protrude off of the portal vein and connect directly to the vena cava. This diverts blood from the GI tract, spleen, and other organs away from the liver and back into systemic circulation. They can be acquired after birth, but the majority of EPSS cases are congenital. The two types are intrahepatic shunts, which grow inside the liver, and extrahepatic shunts, which grow externally to the liver. The symptoms are similar, but extrahepatic shunts tend to be more common in small breeds and intrahepatic shunts in large breeds. For this presentation, I'm going to focus specifically on extrahepatic shunts. So, why is this an idea worth spreading? The first reason is its ability to hide early on. Because EPSS is most common in young dogs, the initial symptoms may be intermittent and mild, as the dog's body attempts to compensate for the decreased liver function. The on and off symptoms make the disease easier to miss, allowing the disease to progress without the owner knowing. The second reason is that PSS directly affects the liver, which is an organ that interacts with almost every other organ in the body, making its effects widespread and dangerous. The final reason is that with the right diagnosis and treatment, EPSS can actually be cured in dogs and they can make full recoveries. All the more reason to know about the disease and its symptoms, since it's entirely fixable. To understand what goes wrong in EPSS liver, we have to understand normal liver physiology and function. In a healthy dog, food and foreign material gets processed in the stomach before traveling down the GI tract, where it gets further broken down before leaching out into the portal vein. The blood entering the portal vein is nutrient dense and contains hormones, toxins, and proteins coming from the stomach, spleen, and pancreas. The blood in the portal vein then travels to the liver, where it exits at the septal branches and collects in these channels called sinusoids. Here, they come in contact with hepatocytes. Hepatocytes are impressive liver cells that carry out detoxification of ammonia via the urea cycle, metabolism and storing of nutrients, creation of important blood proteins like albumin, and even the production of bile. The main takeaway here and for this conversation is that the liver is a detoxification hub that is powered and fed predominantly by the portal vein. So now, what goes wrong in EPSS? Congenital shunts, which are most common, arise due to problems during fetal development. As the dog grows and the shunt gets larger, significant amounts of blood get diverted away from the liver, resulting in less nutrients supplying liver cells. When hepatocytes become deprived of portal blood flow, they also lose essential trophic signals required for normal growth, function, and their ability to regenerate. Over time, the lack of both signals and trophic factors results in a liver that is underdeveloped and metabolically insufficient. Without nutrients, hepatocytes begin to die, slowing the urea cycle down and causing more ammonia to remain in systemic circulation. This triggers neurologic, urinary, and in some cases, GI problems. In dogs with PSS, blood tests will be the first step in determining liver dysfunction. Because the liver depends on the portal vein for 75% of its perfusion, when a shunt diverts this flow, hepatocytes become severely underdeveloped and are less effective at carrying out the urea cycle, leading to low BUN levels and high ammonia levels on blood tests. Since hepatocytes are also responsible for creating albumin and cholesterol, their levels will also show up low on a blood test. To confirm, a vet may suggest doing an ultrasound of the liver to assess size, since atrophied livers are smaller than normal. This figure from the article shows how heat imaging of blood flow in an ultrasound can reveal the presence of a shunt through what they call shunt communication. Hepatic encephalopathy, or HE, is another disease that arises alongside PSS. As we talked about before, when hepatocytes can no longer carry out the urea cycle, ammonia spikes in the bloodstream. When this ammonia circulates long enough to cross the blood-brain barrier, it causes a cascade of problems which lead to neurological signs like dullness, lethargy, and disorientation. But what is going on inside the brain mechanistically that's causing these symptoms? When ammonia crosses into the nervous system, it finds and enters astrocytes, a type of glial cell. Inside astrocytes, ammonia combines with glutamate to create glutamine. This process forces water into the cells, causing astrocyte swelling. Brain swelling normally will appear as lethargy, but in severe cases can lead to seizures. The second part of this ammonia cascade is that the glutamine that was just created in the astrocytes becomes a precursor to creating the neurotransmitter GABA. GABA is an inhibitory neurotransmitter which interacts with the GABA-A inhibitory receptor. So when ammonia increases glutamine, which increases both astrocyte swelling and GABA, the brain is in a state of chronic inhibition and swelling, which leads to lots of lethargy and dullness. Another side effect of increased ammonia levels are the formation and excretion of biurate crystals. Because hepatocytes are underdeveloped and detoxification is insufficient, ammonia levels and uric acid levels are increased in the blood. When these circulate and enter the kidney, ammonia is converted into ammonium and uric acid is converted into urate, and the two come together to form biurate crystals. The kidney essentially does this as a last resort way to detoxify the blood now that the liver is not functional. The photo on the right is from the article and shows one of these crystals under magnification. But when they congregate and build up, they require surgical removal and it can be painful to excrete. All these negative symptoms, from urate crystals to liver atrophy, stem from the shunt shutting off the liver's access to vital trophic factors and nutrients that keep their hepatocytes alive. The physiological effects of PSS make it clear how essential proper liver function is to life, and why knowing and understanding about PSS is important. So now that we understand what PSS does at the physiological level, how can we manage it? Though surgery is the gold standard for PSS, which I'll talk about in a minute, medical management of the disease is just as important for patients who might not be eligible to go under anesthesia. Dietary management, like eating low-protein foods, such as vegetables, can reduce the amount of ammonia produced by digestion. Synthetic medications, such as lactulose, are also prescribed, and they work by converting ammonia into ammonium, and this helps because ammonium can't be absorbed back into the bloodstream, and therefore it works as a way to sort of detoxify the blood. One question that I was still left wondering after reading both of the articles was regarding lactulose. And my question was that if lactulose converts ammonia into ammonium, then wouldn't it be increasing the amount of ammonium available to make biurate crystals, and therefore be exacerbating another negative symptom of PSS? And also, if you're exacerbating the symptoms of biurate crystals to the point that they need surgical removal, then that defeats the whole purpose of medical management being used for patients who can't go under anesthesia. To ensure the best long-term health of a dog with PSS, surgery is the best way to go, since it's the only curative treatment. The goal of veterinarians is to gradually attenuate the shunt, because if you were to close the vessel rapidly, it could risk a spike in portal blood pressure that could risk rupture. To avoid this, amyloid constrictors or cellophane bands are used to slowly close the shunt long after the surgery has been completed. Amyloid constrictors were one of, I thought, the coolest parts actually about learning about PSS. They're basically like a metal ring with a milk casein inner coating that absorbs bodily fluids and expands slowly, basically pushing against that metal ring inward to constrict the vein over time. And this actually has a high success rate for EPSS, but is not suitable for intrahepatic shunts because intrahepatic shunts require much more complex surgeries to be able to attenuate the vessel, which was well beyond my scope of anatomy. But post-amyloid constriction, most dogs experience dramatic improvement or basically complete resolution of their symptoms after surgery. but the liver does need time to adapt, so postoperative monitoring is essential. So the general consensus is that EPSS is not a death sentence, and that dogs with extra-hepatic shunts who undergo surgical treatment actually have excellent prognosis following the surgery with high survival rates and long-term clinical resolution. That being said, dogs who cannot undergo anesthesia and just be managed medically still can live a comfortable life, but may still continue experiencing, moderate levels of ammonia level in the blood and biurate crystals. So I wanted to end my presentation just by talking about one more point regarding the impact that PSS has on society and, maybe some people who would benefit from knowing about PSS. So the first is, I'd say any prospective dog owner who's thinking about buying a purebred dog would benefit from just knowing about what possible symptoms look like, just given that, purebred dogs have a higher chance of getting these shunts. The second would be dog breeders, even to a higher extent than a person who owns a purebred dog, given that they are coming in contact with more young purebred dogs who could be, developing these shunts congenitally. It's super important that they're aware and understand the risks so that they can be aware. And then last but not least is people who already have a dog. I didn't really touch much on acquired shunts in this talk, but shunts can be acquired later on in life. And so, any person who has a dog or, comes in contact with a dog and can notice these symptoms could, help a dog from suffering more. So that's my spiel on why PSS is important.